So most of the signs relating to kidney disease are outside the kidney, and many of them are related to fluid balance. Now, fluid, we're mostly talking about extracellular fluid, and most of that is salt. We all eat far too much of it, and when we do, if we can't excrete it, it hangs around in our extracellular fluid. And there are a number of physical signs that you would expect as a consequence of this. If the fluid is intravascular, if we infused 2 or 3 litres of saline into someone completely healthy very fast, we would see some of these signs straight away. First thing that would happen is that jugular venous pressure would rise. Second thing is that blood pressure would go up. And if you carried on, or if the patient had reduced kidney function, the next thing you'd find that left atrial pressure rose as well as right atrial pressure, and that you get crackles in the lungs from pulmonary edema. If you accumulate fluid more slowly, or if it leaks out of the circulation, then it appears in the tissues. This can be called anasarca, and traditionally this was called dropsy. And of course this kind of edema can have a number of causes. It can be caused not just by leaking protein or retaining sodium in the kidneys, but it can also be caused by liver failure when you don't generate albumin, heart failure when you're just accumulating fluid and not excreting it, and malnutrition is maybe another important cause worldwide. And the fluid accumulates wherever the tissue turgor is least. So in adults, you'll characteristically see ankle edema quite early on, if they're ambulant. In children, it's much more likely to appear first in the face, and indeed adults will very often describe edema in the face when they wake up in the morning. Puffy around the eyes, so that it could even in a child be mistaken for allergy. Ascites is likely to occur in children quite early on, or in adults with liver disease quite early on. But generally, you won't see any of this until quite a large number of litres of fluid have begun to accumulate. So I mentioned all the different causes, and this is meant to show the difference between elephant legs and gazelle legs, described by a patient who had relapsing nephrotic syndrome, so albumin loss, and her ankles were going up and down. Now, problems with too little fluid are also encountered quite frequently in renal disease, particularly when you're looking at patients with acute renal failure. And I'm going to leave that for you to look up elsewhere. Shock and signs of underperfusion. There are a few other characteristic symptoms of renal impairment that have clear explanations. I guess one is breathlessness. Now, a lot of this is caused in renal disease by anemia, so that you get more breathless on exertion than you feel you should. That can be treated nowadays with erythropoietin and other aspects of management. But in more acute or renal disease in crisis, it might be caused by pulmonary edema, fluid overload. And the appearance of breathlessness, although interestingly patients rarely complain of it, may be caused by acidosis, which leads to hyperventilation. Patients are often unaware of it. If you have right-sided fluid accumulation, and pleural effusions are right-sided fluid, just like ankle edema associated with a high JVP, you may get big pleural effusions, which can contribute to breathlessness. And ascites may make you feel breathless just by preventing you from breathing in properly. The physical signs of loss of filtration, though, are very few and characteristically occur at very low GFR levels. This diagram of dialysis adequacy was used to illustrate what a low GFR these symptoms occur at. And if you're seeing the symptoms and signs of end-stage renal failure listed on this slide, you've missed the boat, and these patients need dialysis or palliative therapy pretty quickly.